My name's Jeffery Michaelson. I'm an orthopedic sports surgeon here at the Core Institute. Probably 80% of my practice is shoulder and knee, and the last bit is general sports medicine, which could be elbow reconstructions, hip arthroscopy. But I would say my day-to-day is taking care of knees and shoulders. If you think about the action of the shoulder and the amount of range that you need, and in order to function at a sports level, whether you're playing tennis or swimming, you need a pretty large range of motion. And so because of that, the shoulder really relies not just on its bony architecture to give it stability, but the relationship between the bones and the muscles and the soft tissues to provide it. And when those things fall out of balance, people notice that they have pain. Nobody wants to live in pain, so if we can fix a problem, we like to fix a problem. My father, for years, was a marathon runner and an ultra-marathon runner, and so we have a long family tradition of doing endurance races. Every time my father hurt his knee, he would go to the doctor. And when the doctor told him he should stop running, he just found another doctor. So what I learned from that was you never tell a runner not to run, you always try to understand what the patient's expectations are, and then you work within those expectations. Whether it was a decade ago or it was 50 years ago, there is a real satisfaction being an orthopedic surgeon, and I say this to everybody who asks, this is what I've always wanted to do. I love the concept that I get to see a problem, fix a problem, and have both the satisfaction for me personally that I've done it, and for the fact that the patients really appreciate what we do for them. The best, most impactful was a woman who came to me in her late 20s. She had been a long-time runner, had been scoped multiple times other places, and at the time there was an evolution in some of these new biologics and cartilage transplant that really hadn't been embraced very well in our community. At the time I was probably one of the few who was doing it, and so I had the opportunity to do a cartilage transplant on her, and we're now friends in the running and triathlon community, and she sends me a finished picture every time she does a race. So she went from I couldn't run to 3 miles to she now runs multiple marathons a year. I know she's done multiple triathlons. I know she's done adventure racing, and she never would have had that life had we not met. I love what I do. I feel very lucky and very blessed to do it.